You probably know that children go through a lot of development from babies all the way up through their teens. But did you know that sexual development is an important part of that growth? It might not be the first thing that we think about, but healthy sexual development is key for children and teens as they grow up. Adults have a key role to play in nurturing healthy sexual development. In fact, evidence shows that children who had an informed, trusted adult to rely on to answer questions and provide information on sexual health have more positive health outcomes, like delaying sex until they're older and communicating with healthcare providers. Nurturing healthy sexual development is also a key tool to help prevent child abuse and protect children. So what does healthy sexual development look like? Just like brain, emotional, physical development, sexual development starts at birth and continues through adolescence. Adults can help support children by learning how to be an askable adult. An askable adult provides medically accurate information and uses correct terms for body parts. They talk to children about sexual development in an age-appropriate way. They answer children's questions honestly. They don't use shaming language, and they encourage children to come to them for help and support. Askable adults don't need to know everything, but they can be a trusted support for children and teens. So how does someone start nurturing healthy sexual development? There are a couple things to think about. It's important to ensure that a child's earliest associations with their body and feelings do not become associated with fear, guilt, or shame. Feeling comfortable with their body and with the adults around them can help them communicate any issues or concerns they have as they grow older. Let's look at some common behaviors and how to nurture healthy sexual development from birth to 2 years old. Some common behaviors that someone might see related to healthy sexual development that are completely normal and expected for this age are boys having erections during diaper changes, babies and toddlers starting to explore their body, including touching their genitals. This is sometimes referred to as self-soothing behavior. Children from birth to 2 often like to be naked. They like to be held and caressed by the people who care about them. And they start to learn about love and trust from their caregivers. This is actually a key start to when children start developing positive or negative body images. Adults can help nurture healthy sexual development at this age group in a number of ways. Even if babies aren't talking yet, they are learning a lot. So teaching children the correct names of body parts like penis, vulva, vagina, breast, and anus. Using the correct names for body parts can increase communication between the child and their caregivers or doctors. Be understanding and respectful. Children can have a lot of emotions and a lot of questions and a lot of feelings. Being understanding, respectful, and accepting of this can help children know that you are a trusted adult. This is also a great time to teach children about boundaries and respect. This can be done in a number of ways, including asking a child if they want a hug or a kiss and respecting their answer. Let's take a look at the LAST method. The LAST method is a tool that adults can use to help them answer children's questions. The L in the LAST method stands for listening deeply. Take the time to listen to what a child is saying. Especially for young children and toddlers, they might not have all of the words that they would like to express their question. So listen very carefully and clarify what they're saying when needed. The A stands for ask what they think the answer is. For example, if a young child asks, "Where do babies come from?" we as the adult might have a lot of thoughts going through our head. Asking what they think the answer is can help us by doing 2 things. 1, it helps us understand what their knowledge is. And 2, it gives us time to consider how we want to respond. The answer that we would give when a young child asks that question versus an older child will be different. So if that child asks, Where do babies come from? We can respond, where do you think babies come from? This can be a really helpful way for us to slow down the conversation and still give a medically accurate answer. The S stands for sort out your feelings and the messages you want to give. We mentioned earlier that using non-shaming language is very important to help children know that you are a trusted, askable adult. So take the time to think about your feelings and how you want to respond. It is okay to say, I think I want to take a little time to answer your question. Let's talk about this tomorrow. Or, I'm not sure. Let me find out for you, and I'll let you know what the answer is. Don't feel like you have to answer a question right in the moment. T, talk respectfully, honestly, and provide a developmentally appropriate answer. This goes a long way into building trust with a child and showing them that you care about their questions and you want to answer them honestly. There are lots of resources available to help find those answers that are developmentally appropriate and accurate. Be sure to check the description below for more resources on talking with youth in an age-appropriate way. Although we might not think about it, starting these conversations early can help make it easier in the long run for children and adults to talk about healthy sexual development. For more information on how to nurture healthy sexual development for children of all ages, be sure to follow Trinity Muscatine Public Health on YouTube, Facebook, and Instagram, and stay tuned for more information on other age groups and how to nurture healthy sexual development.